Hi, everyone. Good afternoon. Thanks for joining us today. My name is Chris Lemon. I'm an emergency doc, as you can tell. And so I'm here today to talk to you about planetary health. So I'm faculty at Johns Hopkins, splitting my time between Johns Hopkins Hospital and Bayview. And I'm also the associate director and faculty co-director of the Johns Hopkins Institute for Planetary Health, specifically doing a lot of my work in the clinical program section having to do with healthcare. So again, I'm thrilled to be joining you today to talk about what we've been doing. Talk to you first, mostly about what is planetary health? Let's provide that framing for what we're doing. And then how does that relate to healthcare? Because I think the beauty of planetary health as a framing is it's really applicable to anyone. This is not something that's innovative in the respect that we came up with something totally different. Rather, it's kind of just a common sense way of thinking about the problems that we have in the world and how we can effectively create solutions by working together. So I'm a doctor, you may be, you may not be, but I hope that you're going to be able to take something away from this conversation. So specifically, I'm going to start by telling you a little bit about my path. And this is sort of how I view life, is that we're all zooming down the path of life, and sometimes we're going to crisscross. Some of us may be on tracks that are more parallel than others. And I just hope you can kind of take something away from this as we intersect today. So this is me. This is my family. I'm not doing much for sustainability when we talk about the environment with surprise twins there at the end, but I like to think we're a pretty normal family. Two girls that are very sweet and two boys that tend to not realize they're on camera when they're knocking each other over. And, I've always been environmentally conscious. I grew up with my dad working for the Fish and Wildlife Service. But, what I realized was having four kids in Patagonia and North Face in a 7,000-pound electric vehicle doesn't make you sustainable. All right. So this is my disclaimer for the talk. All these opinions are my own, but at the same time, I'm also calling myself out a little bit. I'm kind of greenwashed in a way myself. And this really changed for me during COVID. So again, I mentioned I'm an emergency doctor. I don't have to tell you what COVID was like for us. I was in full practice a few years out of residency when that hit. My kids were a little bit younger than in the picture there, and it was hard. The stories that I can tell you about people calling their loved ones before they get on a ventilator, or telling me that COVID's not real as they're struggling to breathe. It's just a rough few years. And my partner, my wife, works in a hospital as well. So our kids experienced the formative early years of their life in COVID. And so one day we pulled this out of my daughter's backpack. She was in preschool during this. And as any parent would know, if you see a kid that puts sad as the feeling they're feeling the most in life, it's crushing. That really kind of takes you down a knock that you may be a healthcare hero, but am I really protecting my family? And so that was the wake-up call for me. I was not at Hopkins until COVID ended because I just got so frustrated with how we did. We were in the front lines, in the ring with COVID, fighting. And by the end of it, the hope was that society was going to come together and we were going to rally around this and get through it. And I don't know how you feel, but I don't feel so great about how we did as society by the end of COVID from my perspective as a physician in the emergency department. So to me, the next obvious thing was, well, geez, if this is happening, what's going to happen when we start to feel more of the effects of climate change in terms of natural disasters and heat waves, and how's that going to impact healthcare, straining things further? Not only did this impact my family, but it also just made it so that I was all of a sudden realizing, what am I doing with the rest of my career in this platform? And so that's where I looked at Hopkins. I will admit, and I know this is an alumni association, video here, but I'm a Maryland guy. I went to University of Maryland across town in Baltimore. So I was there from med school through residency, 10 years downtown on the West Side. And I realized that Hopkins is such a unique place when I started to look into the resources and people that are available in terms of me formulating these ideas about climate change and health. And credit to Dr. Gabe Kellen, who's the chair of emergency medicine, brought me onto faculty to start working in this space of how can we kind of try to figure out how to safeguard our specialty in our future. And I admit, I think this is how I started talking. I'm walking you through my story because I think you may have a similar on-ramp into planetary health. When I started lecturing residents and med students about climate change and health, I think reflecting back on 2.5 years ago, this is probably what I looked like, going on about how heat is going to impact people in terms of causing more heart attacks and more strokes. it's going to affect people disproportionately. If we have droughts, people aren't going to have access to clean water, and then Lyme disease, and then dengue, and then all these other things. And it becomes very quick that you realize you're going to freak out some people, and some other people are just going to shut off because they just got through COVID. So what I'm taking you to is, how did I come to Planetary Health? I happen to have been lucky enough, shout out to my friends at the Bloomberg American Health Initiative, happen to be able to enter this program as a fellow and in the environmental challenges section. And that means working on a master's in public health in this space. I heard rumor from Dr. Joshua Sharfstein when I met with him briefly, there's going to be these people coming down in a few months. They're from Planetary Health. You should talk to them. And then he had to go again. This is the great part about Dr. Sharfstein, is he gives you exactly what you need, and that's it. So who are Planetary Health people? What is that? This is just 2.5 years ago for me. And what I realized when they started to materialize for us is Planetary Health is a way of thinking about human health as it relates to the planet's health. So we're not just going at climate change and everything that's going wrong. It's the entire breadth of experience that can exist. So these Planetary Health people, when I looked them up, were not just doctors, but they were people from all different sectors working together to try to figure out and crack this issue that I was coming to realize. This was a better articulation of what I was teaching my med students and residents, was that the patients we're seeing in our clinics, in our hospitals, are a product of what is going on in their environment. We teach social determinants of health. We teach structural determinants of health across the years now in medicine. These are not new concepts, and this is not superseding or changing that. It's just reflecting that these things are interwoven with the environment, but we need to not just look at climate change. We need to look at how all of these things interact with one another to impact the health of the patients we're trying to care for. The way we like to think about that in Planetary Health, let's frame this a little bit differently, is what makes our planet so special? Again, we have a lot of people that do really amazing things in space at our applied physics lab, and we're looking for planets that are habitable elsewhere. And yet, if you look at what is so incredible about the planet around us, is that after billions of years, it has formed into this perfect cradle for life to exist in a very homeostatic and stable type of environment for the last 10,000 years. And that's really unique when you look out across the galaxy and you can't find anything like that. And so then look at what's alive on the planet with us. What came before us? What are all the other creatures? I'm a doctor. I understand human health, human physiology, but I also understand that that's a byproduct of the evolution of how we got here. And that to me is something where, again, we're looking for intelligent life out there. And it's not to say we shouldn't be. I just mean to say, did you stomp on intelligent life today with a shoe if you saw a spider go by? There's an amazing world that's just around us right now. And I think, if you're the kind of person who goes out into the sunlight in the morning and smells the grass and hears the birds chirping, you're taking a moment to sort of calm your own human physiology by experiencing the world around you. And so then I bring it to the fact that, I don't know if you thought this was going to be a talk about, oh, humans bad, environment good, we should separate these things. I think this is a story about legacy. Planetary Health frames things. I'm a doctor. The whole point is to keep people healthy, to keep them happy, to have them have meaningful and productive lives as they see fit, and the liberty of that. And in order to do that, we have to have stable societies, stable planetary boundaries, stable relationships, and a healthy understanding for how all of these things interact together. So as I say, what is our legacy? Of all the life that's ever existed on this planet, we have art, we have culture, and we have rapidly expanded our technology and capacity to do things. And honestly, I'm saying that's on the legacy of fossil fuels. We got here because we learned how to use energy. I think the question is not to say that that was the wrong thing to do, but this is the Anthropocene. We now run the show. We were sort of connected and fused with nature. And now, because of how smart and how adaptable we are, we've started to pull away and think that somehow we are better or separate from natural systems. And so what I would say is, think about this question again, is what is our legacy? We do these amazing things, as I said, with culture and arts and science, but the expense and that bill is coming due. And we have drastically and irreversibly changed aspects of this cradle of life we were just talking about. We have decimated significant portions of the rest of life on Earth in elevating ourselves above this status of thinking we're different than the natural world around us. And so the point that I'm making here is, what is the legacy that we want to leave? I've got 4 kids. And when I think about these things, on the one hand, I am amazed and so fortunate that they are here today and not 400 years ago, because I think I'd rather be alive today for all the reasons of advancement we just discussed. But the flip side is, in the future, are we reaching that tipping point where things are going to start to backslide? We call this Earth crisis. This is the moment that we're in, and what is the legacy we want to leave? So looking at planetary health as a framing a slightly different way, this is what we're talking about. Certain things that we do to the planet impact the environment, which creates scenarios of imbalance. We are exceeding the planetary's boundaries to allow us, it's carrying capacity for us in a sense, to push the climate, to pollute our water, to basically switch around the systems that allowed humanity to get a foot up on the rest of the world. And those things turn into problems for health. So it's culture and values and behavior. I mean, that's part of planetary health. It's not strictly a scientific discipline. It's a way of thinking and a way of living. It's a community of practice, understanding that there are multiple things. And it's not anything against climate change. It's that climate change is part of one of the threats that we're dealing with, but there are many others. And these affect things that are impacting what I see in the emergency department, what other doctors and nurses and techs and therapists are dealing with. And as we've already been taught in medical school, depending on who you are, you're going to experience these impacts differently as you look through different lenses of things like your wealth and socioeconomic status or the infrastructure of where you live. So to make the point back to where I was once upon a time, 2.5 years ago, again, this is not that long ago. If I can do this, anybody can do this. What I'm getting at is there are lots of things to consider. And when I was focusing just on climate, me personally, what I found was the way I connected to that was a lot of things that are going wrong. And what I found is, looking through it from a planetary health lens, this fits my emergency medicine mindset. I'm talking to different consultants from the hospital all day long. I'm now realizing how many different ways this impacts us, not just on a climate trajectory, but talking to people from every aspect of our society about these problems that are coming together to impact our health. So basically what I'm saying is planetary health is a large framing. It's a way of thinking. It's a way of researching and understanding problems, but it's also a social movement of a way of getting people to connect that overcomes things. I mean, God, if I had one dream for my kids, is that we could just kind of overcome the political strife that exists. And I think most Americans feel that way. I'm not getting political and saying anything other than I'm proud to be an American. And I hope there's a way that we can find common grounds to advance things so that we have a better future for my kids and your kids. And so planetary health is looking at this as this broad framing. So when I was looking up these, quote, planetary health people, what I found was I was looking at faith-based organizations. I was looking at universities, at governments and non-governmental organizations and individuals in various places. Planetary health is not something for doctors, but doctors are a part of it. Anyone is a part of it. And suddenly, again, coming out of this pandemic of SARS-CoV-19, but also the current concerns regarding loneliness that we have in society right now, it became clear that there is a lot of ways of multi-solving with planetary health that makes me fall in love with my own profession of medicine after the burnout of COVID, but also provides me a way of talking to my kids about what I'm hopeful about, rather than just lecturing about everything that feels like it's going wrong. And so the planetary health people that I was learning about were in this group called the Planetary Health Alliance. So you saw the number 10 on my title screen. Planetary health has only been around for 10 years, and that was as of July 16th, 2015. So in just under a week, planetary health as a framing is 10 years old. This is not something that's been around for decades and decades. And this alliance has grown from this international secretariat, the sort of touch point of where this formed at Harvard and other organizations around the world. And it's doubled, I'd say, in size since I have started to notice this in the last 2.5 years. It's now over 500 international organizations and growing rapidly right now. And there is a great little comment about this. When I said the Planetary Health people are coming, they relocated to Hopkins. And so the Planetary Health Alliance's International Secretariat is now at the Bloomberg Center in DC, which I'm sure many of you have known about. It's a beautiful building if you haven't been there. But the Secretariat is not headquarters. This is a global community of practice that's not run by Hopkins or us, but we have a connection and a touch point to it. And I think that's something that's really special and unique because it means we have a connection to the rest of the world of practice for this discipline. But I'm talking to you from my platform at Hopkins, and that's the Institute. So the Institute for Planetary Health at Hopkins, or you'll see GIF is the acronym on there, is more looking into Hopkins. I gave you those lists of things that planetary health is or could be. Why do those things not fit into the context of a university? And what better place to do this than Baltimore? Again, where I lived downtown for 10 years. And I understand planetary health is not just about the big picture things, the flashy things, the aquarium, and sort of putting the name out there that this is Baltimore and planetary health fits. But these are the patients that I treat. These are where they come from. These are the people that I want to help in the emergency department. That's why I picked emergency medicine. This is the side of Baltimore that keeps people at Hopkins because they care about Baltimore, the whole thing. And that's what Planetary Health is about. So we launched the Institute. Basically, off of Dr. Sharfstein's commentary, I chased down the Planetary Health people. We built out our clinical program section, but I am one voice of a whole group of people speaking to you today who could all give this presentation with their own spin. And you'd find commonality and you'd find differences as we get into the healthcare portion in a little bit. But after 1 year in operation, as of this spring and April, we posted an impact report of what we've been up to. And after only 365 days of work, what we found out is that when we tried to bring together people from across this Hopkins community to build on the idea of solutions that we can generate as a collective group of people at Hopkins and leverage our strengths that we have here. Again, coming from the outside of Hopkins, it's just got this reputation. There's something magical about this place in a lot of ways. How do we harness that for good? And what we found is very quickly, the community exploded at Hopkins in a good way. So we were having monthly dinners where we'd invite faculty together from across Hopkins as a university. And yeah, hundreds of people across these dinners showed up, many of them repeat offenders because they get a different perspective at every single one, but they represented almost 70 departments, centers, and institutes at Hopkins. And in total with the convenings, the conferences that we were putting on and meetings, almost 2,000 people that we reached from Hopkins. But then when you look at the website and the number of people that we're reaching with our presentations, both within our core group at Hopkins, but also externally, it's a lot to do in a year, and we're making progress. If you're interested at all, again, shout out to Dr. Sharfstein, from the Public Health on Call fame from that podcast. We've had a few episodes on there if you'd like to check them out. But also we did a publication with the Public Health magazine, and yeah, thousands and thousands and thousands of deliveries on that too. And so needless to say, this is not something where I'm the one who did this or we're bragging about it. The point is the concept is sticky. People find their way into this and they realize that actually what I'm studying, what I'm researching, what I want to go into when I'm done being a student fits into this somewhere. I can see my picture of where I'm going by looking at planetary health as sort of a map to figure out where am I on the big macro view. And so we keep pulling in more and more people, and that's lovely, but we still want to grow rapidly. So this picture, when I gave this talk several months ago, was maybe a third of the number of people. Core people that are coming from across Hopkins, just looking across this, we have a NASA aerospace engineer who's working on the cryosphere. We have a built environment expert from real estate at Carey School of Business. We have somebody who's a UN environmental policy lawyer who was working on the plastics treaty. And it just keeps growing as we find more people who want to come and build in an entire new program to what we're doing. We've tried to figure out how do you take all these people and divide them in a way that makes sense because we're saying we're being holistic. Basically what we did was it's broken into several sections. So in education, they are pushing forward, trying to engage every student and faculty in ways that meet them where they are in terms of where they are in their lifelong educational process, but also looking out to the community in terms of the kids that are in Baltimore City that we're trying to reach as well. In terms of policy, just a few weeks ago, finally signed with a new collaborative agreement on sustainable development with the United Nations Development Program. So the Institute of Johns Hopkins is now going to be collaborating with UNDP on thinking about how we do sustainable development in terms of the influence of planetary health. How do we find ways to connect these systems for better? We're also working with Georgetown Law on a relationship to build in more of this emerging field of planetary health law and looking at the governmental policy on an international standpoint. Practice is basically, how do you actually do this stuff? Because again, when I was going off about climate change and health, to actually get things to move in society, you have to look at economics, you have to look at business and engineering. When I think about it that way, I realize, I take care of patients, the blue collar workers, that are there right now. They can't miss a day of work. Patch me up, doc, get me back in. I don't have health insurance, et cetera, et cetera. I understand what levers these people pay attention to because it's paycheck to paycheck in life and death. How do we actually build urban cities to support this kind of idea that it's not just health isolated or that we can somehow avoid certain taboo topics? We have to engage people where they stand. I'm going to skip care because I'm coming back to that, but we also have a robust research, clearly at Hopkins research, that's growing quickly as we're adding on new hubs. We just built out infectious diseases and air quality with more planned in the future. So to talk a little bit about healthcare, that was the whole point of this. Now that I've framed out planetary health and where it's been going, I want to bring you into my world a little bit and what we've been doing within the clinical program section. When you walk down the hall from our outpatient building where my parking lot is to the emergency department, I see this every day. I think of it like kind of, slapping the sign on the locker room as you go by to go to your shift, because it's going to be stressful and it's going to be a challenge. And I really do believe this. And when I read this, that at Hopkins Medicine, we push the boundaries of discovery, transform healthcare, advance medical education, and most importantly, create hope. I just want to make sure that you realize, to me, this very much fits with what I've just been saying about planetary health. And it's not that I'm having to force it on it or the other direction. It's just naturally, I can understand why I feel like I have something to contribute to planetary health from the vantage point of planetary health and healthcare. So we're working on 3 priorities. The first one is education. The School of Nursing at Hopkins this last year has done some really groundbreaking things. And I will even say, I think they're ahead of us at the School of Medicine in that School of Nursing has incorporated planetary health into the framing of its master's in nursing program. And so they are working with our education section at the Institute to try to come up with the core competencies that go into understanding planetary health and nursing and how it fits for them, with the hope to grow this to some of the other doctorate programs that they're doing. The School of Medicine, we're just taking a slightly different approach in terms of engaging the students a little bit more about where they're seeing planetary health popping up in their curriculum, everything from a disaster medicine or disaster medicine selective that's now been moved to their 4th year. Clearly, the way we do sustainable development is going to impact the way that we are understanding our risk from disasters, and that's a healthcare issue. There's a place there. There's a way that we can start talking and engaging with these faculty coming to the dinners to help them incorporate some of these concepts seamlessly into their lecture. If you're an infectious diseases doctor talking about mosquito-borne illness, you don't have to change your lecture to incorporate a comment about how things might be changing in the future based on projections that we're seeing for vector-borne disease. So we're looking to engage our curriculum as well. But the other thing is there are a lot of pre-meds at Hopkins, and they go to a lot of different medical schools, and we want to be supporting this portion of our medical student community as well. So I'll be teaching, watch out everybody, teaching a first-year seminar at Homewood this fall on planetary health, basically for pre-meds. It's what is the practice of medicine in the Anthropocene. But what we're actually formulating, we're doing our strategic plan right now, is what's it look like in the future? And we're talking about creating a whole student network that links any organization that already exists at Hopkins that has something to do with this big context of planetary health, not to put them under an umbrella, but just allow them to find each other and connect in interesting ways, because I think that's the whole point of planetary health and the one university framework that we're supposed to be following. Within the health system itself, this is number 2, we're trying to make things greener in terms of our operations, but I would also argue more resilient. You have the Hopkins Sustainability Leadership Council, our Institute for Planetary Health, and Hopkins Health System. And we're looking at ways to collaborate and work together so that we're actually making healthcare operations greener, but at the same time, allowing that to translate to the education for the students and nurses that are doing their programs within our spaces. And lastly, workforce development. We're basically creating a whole ecosystem, this life ecosystem, where we are trying to train leaders in planetary health. And that's in different ways, at all different levels. We launched in emergency medicine a planetary health fellowship this year. And the first fellow is up and running. Dr. Mujais is doing a great job. But we're also creating integrated tracks. Actually, the disaster medicine fellow, Dr. Ayalushi, is going to be working with the Institute to create a track certificate that she's in disaster, but you can imagine pulmonary and air quality, infectious diseases, preventative medicine fellowships that already exist here at Hopkins. We're eager to say, you have your fellowship. Can we support an extra track to make them more connected to the Hopkins ecosystem? And third is, in the future, we're hopeful to make these more accessible to people outside Hopkins with various offerings that use continuing medical and nursing education. So again, this framework of planet and humans is really important, right? I'm sitting here talking about how I'm looking at the human system and I'm realizing all the influences that have an impact on that, but also all the things that humanity is doing to the planet. You know, these things are inextricably linked. So what I want to do with you is kind of take a minute and say, what if you look at this from my perspective? Let's, go deep and dive into the healthcare and the emergency department. If any of you have been watching this TV show called The Pit, maybe you've kind of read that it's actually really good. And I'm not a Grey's Anatomy fan, but this show, I'm going to show you the quick intro sizzle clip, feels like what it's like to work in an emergency department. And when I say that, I want you to do a little task. You can put this in the chat or just sit there and ponder about it. But as I now show you what my day is like, I want you to think about my perspective now that I'm thinking about planetary health. It's not just grinding through patients, but all the things that make my job either stressful or rewarding, and kind of seeing those touch points with the patients that I'm dealing with and the job that I do.
Hey, D, what's a good word?
We're 52 in the waiting room, and it's not even 7.
We're always working the shift, by the way. Got a little slack today. It's the anniversary of Dr. Adamson's death. Who left this mess?
Nothing like a little challenge every now and then.
We've got some new faces with us today. Hi, come on over.
I'm so happy to be here.
Talk to me at the end of the day.
Clear.
Forceps.
Full suction. Med student down.
Welcome to the pit. Let's go save some lives.
Systolics only 80, 14.
Alex, you've lost a lot of blood. You need to go to surgery right away.
I'm gonna die.
Not now that I'm here.
Easy, easy.
I'm in.
Good, well done.
That was awesome.
Is it always this busy?
No, it gets a lot busier.
There's a nursing shortage across the country.
That is bullshit. If you paid them a living wage, they'd line up to work here.
Other hospitals are managing this crisis. Either step up or step aside. Are you okay?
Why wouldn't I be?
It's 5 years ago today. You can't block your feelings forever.
Oh, you'd be surprised.
Crash car, let's go! Epi.
No pulse. Clear.
Whole compressions. Are we ready to call this?
$150,000 people die every day in the world. Today you got one of them. And we're gonna get more before the shift is over.
Tier 1 trauma now.
4 of morphine, I'm gonna stop the bleeding.
You learn to accept it, find balance.
You found balance?
No, not even close.
So even I get a little triggered watching that, because I think that hits the point that I'm getting at. Was I don't think I had great balance going through the pandemic until I came out the other side. When I started to realize my position in the world, but also as an emergency doctor, the opportunities you have to see and talk to people about their problems and understand the complexity of their hopes and dreams. I mean, this is the stuff that goes into med school essays, right? This is the calling we all refer to, but it's also, it's not just docs, it's nurses, it's anybody that works, it's any of our team in the health system, all working together to try to save these lives. And I see Cindy in the chat wrote that it's chaotic and pointing out surely going to get worse as things get worse. And that's what I'm getting at. That's why I came to Hopkins, because I saw that and I was looking for a way to try to make that better. So what I want you to do real quick, this sounds hokey, but just take 2 fingers, put them on your radial artery right by your thumb. If you slide it down, let's make sure you have a pulse. Most of you probably just have a watch now that tells you you have a pulse, but just feel your pulse, because this is what we do when we feel like things are getting chaotic in emergency medicine. Our training is, yes, heart attacks and strokes and all these other things, but it's also about being able to control your pulse, control the tone and the pulse of the room. Because if you're not the most calm person in the room when everything falls apart, what good are you? And so what I've realized in going through this journey is, now when I check my pulse in the emergency department, when I'm getting stressed or overwhelmed by these potential problems, overcrowding in the waiting room, administrative issues, and I love our administration. I just mean to say, like, the business of medicine is harder. The fairness of medicine, the angry people, the impacts and stress they bring with them. When I check my pulse now, as it feels like things are going to get worse, what I realize is that pulse, that's my legacy. We just talked about the history of the world and the place of how we all got here and where we are and the moment we're in with the Anthropocene. As long as you still have a pulse, you have a potential for impact. And I think that's what Planetary Health gets at, is there is a way that you can engage our system. You know, I love the nature videos here. I think of us all kind of like a colony of ants, different sizes and shapes and colors with different purposes to get a collective job done. And Planetary Health actually has a document to speak to this declaration that talks about all the sectors of society and how basically if you've got a pulse, you have a skill set, you have an ability to interact. And if you're like me, you go from being very burned out to very motivated. And I think that's important. When I look at healthcare and the future of healthcare, as we were just saying, talking about the struggles of everything that we're going through, I would say that, you know, one of the things that catches my attention was we heard a lot about misinformation and disinformation, especially during the pandemic. And when I look at Gallup polls across the years now, this is the most recent one, healthcare professionals are still at the top of the list. Nurses, pharmacists, doctors. What I want to point out is it seems like everybody's being trusted a little bit less. And I'm not an expert in this. I'm just saying, when you look at where we are the trusted voices at the top, even if we're losing some ground. When you look at who's at the bottom, I see, let's see here, car salespeople, no knock on them, but then we get down to members of Congress and lobbyists. And who has the power, you know, kind of who's influencing us in these spaces. What I mean to say is we need to use all of our collective superpowers in the way that best suits us to try to get things done. So I'm making it sound like healthcare can just come out and talk about all these complexities and make everything better. But I want to take a humble stance again. I think that we have done work, which is great at the Institute, but we have work to do. And I'm going to give you 3 things that have happened at Hopkins, even since I've been here, that have brought my attention to this. We launched that magazine with public health that I talked about, where it does all these great, you know, collaborative pieces, like you see the smokestacks in the background there. But, you know, ironically, we talk about Curtis Bay, which is the second largest coal terminal in the US, where we have ash and everything falling on our communities. But then what ended up happening was, right around the time we were talking about the magazine, the Curtis Bay Energy Waste Incinerator, this is the largest medical waste incinerator in North America, is there. I didn't know that, and I've lived in Baltimore forever. This place receives medical waste from as far away as Canada and brings it to Baltimore and burns it. And it's not to say that that's wrong. You know, like, we have to dispose of medical waste, but at the same time, it wasn't being burned adequately. And you can go, you know, on news sources, et cetera. Don't just take my word for it. I'm just saying that there was a situation where one of our communities, the people that we treat in our communities that come to our hospital for care, theoretically are having issues from the medical waste being generated from the hospitals in Baltimore. And that's sort of the full swing piece of this thing here. Is it's not far from where I work. And what are we going to do about it? You know, that's the other half about it, is you can't just shut down the hospital. Nobody wants that. If you get sick, you're going to want people to take care of you with advanced medicine. But our med students started pushing and saying, let's collect things from the ORs that are considered wastes, you know, clean waste, and build something artistic so that it makes a statement. And then we started publishing, and Hopkins did a great job standing up and saying that this is not okay. And we've started sustainability committees, and we've been working on medical waste recycling. And so I just think that, you know, this is something where we can engage in a way that it accepts the fact that people need healthcare. Healthcare does produce waste, but are there ways that we can bring that to light and try to balance it and not sweep it under the rug? Second point I'm going to go on to just for time here, and then I'll take a look at the chat for some more questions, is that there were some hurricanes. Maybe you heard about these a few years ago. This also happened last summer, fall, where Helene and Milton rolled through. Did you know Hopkins has a hospital in Tampa? All Children's Hospital is part of our health system. These are our teams. And where they were in Tampa, unfortunately, was right on track. So when the first hurricane just veered off and missed, it certainly caused consternation, but also impacted the homes of people who work at the hospital, even if it wasn't a direct hit. And then when the second hurricane hit dead on, well, that's a whole different issue, right? And so what I came to find was I had gotten to meet the head of the health system at a Planetary Health event that I was representing, and got an email back from him when I asked, how's it going with the hurricanes down in Florida? And he sent this amazing, I've been up for 36 hours, still wrote a whole page describing how his heart went out to the teams that are standing up to provide care to those kids down in Florida. And I just say, our system's going to be resilient. So we've tried to act on that too. And we joined with the Center for Health Security and have started adapting models from community resilience to fit hospitals as communities. And this is actually great news, is going to be pushed into a further bigger project at the School of Public Health now called SHIELD. So be looking out for more on that too. And the last thing I want to bring up, a quick one as we're kind of winding down here, is you may have heard about this in the news recently. So I was at Hopkins Emergency Department, and I took care of a patient who came in with an asthma attack because she smelled gas in the parking lot. And the next morning, 5,000 gallons of fuel were in the bay. And as it turns out, that came from trying to fill our generators for the hospital. And so that met with a bunch of social media and media backlash about this being Hopkins' fault. This goes back into the medical waste incinerator, conundrum of, I've been in the hospital when those generators have kicked in. And if they don't work, neonates in the ICU die. Like, you have to have the generators, but are there ways that we can be more conscientious about the operations of how we're doing things and more careful? So again, this is not assigning a blame. It's just bringing up three scenarios while I've been here to say, we have this amazing institute, we're doing great things, but we are very much enmeshed in the reality of the complexity and messiness of life and operations of keeping humanity healthy. It's our job, but we're trying to do no harm. And what I invite you to say is, we're trying to make these situations less common and less likely by the mechanisms that we have available to us. So I kind of want to wind down, and then we'll get to the questions here with story. We have a lot of people telling our story for us. This is what Hopkins does well in Baltimore. This is what Hopkins doesn't do well. But Planetary Health is about creating your own narrative and putting it out there for the world to see from your perspective. How many content creators exist now talking about their perspective and authenticity? What is your story and how does it fit into this? So when I was sitting in our Planetary Health annual meeting last year in Malaysia, the Open Planet production company has partnered with the Planetary Health Alliance and provided free content online to do a lot of this design work that I'm doing in the background, because they understand that if we can make healthcare individuals better storytellers and more engaging to get their perspective, what I'm seeing in the emergency department, and you watch it on TV, you think you'd pay attention to what I'm saying as well. How can we be better storytellers? So this is a tool I'd like you to know about because it's available to all of you.
Okay, Lauren, let us know what you need. I've never seen anything like it.
So I don't know about you, but as I watch that, I think that could say this is Hopkins. I mean, when you think about all the amazing work and people that come together in this unique place doing the work that they do, to me, it feels like that as an outsider who's been welcomed in the last couple of years. How can we try to engage people to be more active and vocal about what they're seeing in the world? This is the same production company that works with David Attenborough and Netflix and Disney and all these other big documentaries that you watch that you've undoubtedly seen. It's the same group trying to make us all better stewards. So I met them at the Planetary Health meeting last year. The new Planetary Health meeting is coming up this year. It's going to be in Rotterdam, and we welcome anybody to come who'd like to join us there. And so, kind of wrapping this up right now, and then I'm going to go through all the questions that you've had throughout the course of this. I just like to say, from healthcare, there are questions about the scale, and then at the same time, how we're impacting patients on a one-on-one, with a comment about aging adults. That's the great thing about my job. As stressful as it is, and sometimes dangerous as it is, I have the opportunity to meet across my career tens of thousands of people as one person. I have a chance to check their pulses the same way I'm checking mine. And with that pulse check, assess their legacy as well. Where do they fit into this matrix of the world that we're facing? What is our moment and legacy in this Anthropocene that we're all generating at the same time? And when that pulse flickers out, that's the end of the legacy that you've built for the future with your own power, that life force that you have. And so in healthcare, we need to be better trusted storytellers of the messages of the people and patients that we're seeing. To the point that's coming up, Cheryl mentioned about aging adults. I can tell you a lot of statistics about aging adults and the impact, for example, of heat and the number of millions more mortality that we're going to see in 10 to 50 years from now. But if I tell you the story of a patient that I had who developed a traumatic brain injury because he was trying to get to work and biking in a heat wave, and now he can't work anymore, he left the emergency department against medical advice because he had to go home and turn off his air conditioning. He couldn't stay admitted because if his AC kept running, he'd run out of money and get kicked out of his apartment. We have the ability to tell the stories of everyone that we come across in a way that captures people's attention. And you're showing that because the pit is rated really well. But how do we do it in a way that respects the fact that I'm just a doctor? I need you. I need the clergy. I need economists. I need artists. I need everybody in different aspects of society to figure out how we put these pieces together. So I would welcome you to engage us in any number of different ways right now. There's a link there to our institute, as well as the Alliance. Again, Hopkins faculty, students, et cetera, can join the Institute as part of the Hopkins community and alums. The Alliance is open to anyone from around the world. And so we want to make sure you have ways to connect with us. And I will also just, kind of as a thank you, it's hitting pretty close to home right now. So I know I look a little unshaven and I'm still in scrubs right now. So, so I was putting the final touches on this. I will say that last night, my mother-in-law got very sick. So she went into the hospital with what was determined to be a kidney stone. And as an emergency doctor, I've definitely seen these go south when you get uroseptic, and she was okay. And then all of a sudden she wasn't. And blood pressure 60s over 40s, on pressor medications, taken emergently to the operating room, level 1, came out of it, several hours of touch and go in the ICU on multiple pressor medications. This I'll dedicate to her. So Diana, you're doing great. But I just want to say that that's the point. We don't want to take all the things healthcare is doing to the world, the waste we're generating, the carbon footprint, and say it's not worth it. Humanity is worth the investment. We just need to see the investment through. I want my mother-in-law to survive just the way I want my kids to have a healthy future. These complexities are something that you can understand in a different way. Planetary Health is just a way of making those connections and articulating them. You all understand this innately. So again, that one hits close to home, but another final example of even what's on my mind right now, not just as a doctor, but as a human being and son-in-law and family member of what I hope we're doing right and what we can probably be doing better. So I appreciate your time. I'm going to pivot right now and go through the Q&A portion for the time that we have remaining here. So if you have any questions, please feel free to put them in the chat and they'll come over to me. I'm going to go backwards a little bit and mention some of the questions we saw earlier in the lecture, but this is how we're going to finish out the next several minutes. So again, thank you for your attention. So it says on here that Peter had a question about the size and scope of the problem, saying the scale of concern in the meta crisis is key. How does the planetary health movement resonate with regenerating bioregion movements and associated indigenous views? Huge. So the Planetary Health Alliance has regional hubs, and they intentionally started outside of North America because we had the International Secretariat here. But what they've realized is as they put hubs, Africa, Southeast Asia, they've come back around to North America again. As we finish out all these hubs, their next step is they're creating an overarching indigenous hub to connect the voices of indigenous knowledge and honestly things that they've been doing right with the environment and planetary balance for eons. And they know how to be stewards of the land in a way that we've forgotten. So the planetary health movement is definitely moving forward on that. And yes, we have connections to things like regenerative agriculture. We're trying to bring back health to the systems that have been knocked out of balance. Cindy on here mentions that, do you think that medicine as a field is uniquely or particularly able to break through the barriers to cooperation or even acceptance of climate change? Yes, and I know I touched on that a little bit. There is a whole rabbit hole you can go down into of the climate and health movement in medicine. And again, that's to point out, these are not our adversaries because they're technically climate and health and we're planetary health. The whole framing here is different ways to work together. Think of how doctors work on the human body. Again, that planet-human interconnection. If I'm taking care of somebody with multi-system organ failure as an emergency doctor, I'm a jack of all trades. I need to call the nephrologist to put them on dialysis. I need the infectious diseases doctor to try to stabilize what antibiotics we're going to use to kill that bug. And I need the pulmonology and critical care trained provider to get this person to the intensive care unit and continue to work on balancing vents and other settings that they're working on. To take care and stabilize a critically ill patient requires multiple providers. And if you're a family member in a hospital, you want all these people working together to fix your loved one. So even that just as an example of articulating the planet is critically ill right now. And I can tell you as a doctor that a quarterback here, I'm calling the shots for what I'm seeing for who we need to get involved. But this time, like I was saying, it's a banker, it's a culinary artist and chef. It's all these different people that have different perspectives on how we feed the world and clothe the world and keep it healthy that come together in a way that I think doctors and nurses, even more than doctors, are still trusted more than most other people. Zooming in a bit, Barbara asked, are there any daily habits you've changed or would recommend to others because you became more aware of the planetary health connection? Yeah, go figure. My Rivian there is not, fixing the planet, right? Energy still comes from somewhere, and I totally get that. I think we were just we were at this World Association of Disaster and Emergency Medicine, this convening of the heroes. When I say people that run into the earthquakes, these are the people that respond. And amidst all of these heroes, talking about planetary health, one of our disaster medicine fellow, the one that's working with us, asked a question of very bluntly, how do you see your footprint on this? She knows clearly, I have 4 kids. I have a lot of things that are taking a lot of energy. So I don't eat much meat. I don't print things if I don't need to. I do Zoom calls rather than in person where I can. I do these small changes. But to me, if I can get health systems to pay more attention to this, health systems in the United States generate 8.5% of our carbon footprint. So I can do a lot as an individual, but the point is we can all take our ecological footprint, our climate shadows, whatever you want to call them, but you have to multiply them to an insane scale to realize what sectors are doing, defense, for instance, but we need defense. So how do we work with these sectors and engage them with a framing that makes them realize what's going on? And maybe actually there are certain aspects to, for instance, clean energy that are cheaper. There's a business case to be made for some of these solutions. Regenerating land that is useful for agriculture is more profitable than letting it sit fallow with practices that are short-sighted, is what I'm getting at. And so, I'll admit, I managed to give a talk to the Department of Defense, which then led to giving a talk at the Air Force's programming and planning meeting. And I'm an emergency doctor. I'm not a defense person, but when you kind of learn this language and your perspective and stories, people start to listen. All right, and I know we're kind of keeping an eye on time here. Cindy has another question. Great question. Has AI made an impact on any part of addressing planetary health? And do you think Hopkins can play an interesting role being so multidisciplinary and right on about the upcoming AI and Data Science Institute? That is an amazing question. So yeah, don't get me wrong. Every time that I'm formulating an email and I check something in AI or put it through ChatGPT, I'm like, oh, there's a whole different aspect of my, ecological footprint that I wasn't generating before. And actually, we're using more AI in medicine every day. And it's not the foundation of medical practice, but it's certainly a part of it. And I think it's unrealistic to think it's not going to be, okay? When I say that, it's amazing what we have at Hopkins in terms of resources. When we start talking about APL and the modeling that they're doing with satellites and imagery and collaborations with organizations like NASA, I mean, it's incredible what they're doing. But now that you're adding this whole new data science and AI center to Hopkins, I was chatting at a Hopkins dinner the other night with the gentleman who runs the Institute for Assured Autonomy. Used to build autonomous subs for the Navy, and that has now turned that into saying, how do we make sure that AI is doing the things that we need it to do? That's the whole point. How do we make sure that it's accurate, but also being targeted at things like planetary health framing to allow us to understand that we have more knowledge than we've ever had before, more computing power than we've ever had before. These complex issues might just be a little less complex when we start to turn AI against the problems that we're facing. Let's see here. Just putting out a plug. Cheryl on here is I produce and host a podcast called Aging Matters, a weekly interview program that focuses on educating older adults and their partners and families and aging related issues. Happy to have you as a guest. Well, thank you, Cheryl. I appreciate that. And check it out on the website, agingmattersonline.com/radio show. I would just point out there, yes, there's a whole geriatric specialty. Again, when I said I'm calling consults from everybody about what's going on, geriatrics is part of that. My mother-in-law is 75. Her systems are not as resilient as they once were, as are the planet's. She's not going to stand up to heat stress as easily as someone else, or environmental concerns are going to knock her down a little bit, and a UTI or a kidney stone sweeps in, and she's far less resilient than she used to be. Totally agree with what you're saying there, and I really appreciate that comment. Let's see what else we got here. Thank you for bearing with me as I go through this. I think there was one other question. Oh, thank you. I'm going backwards to some of the ones from earlier today. Lisa asked, how does planetary health as a concept differ from global health? I will say again, as someone newer to the field, but at the same time who has been completely enveloped in it, you talk about international health, global health, One Health, climate and health, eco health. You can find a dozen different framings that are all, I don't want to say vying for, because it makes it sound competitive. Let's face it, academics is competitive. We have rank lists against each other. We compete to get into these programs, and it's usually academics that are generating these framings. In terms of differences, a lot of the sort of international and global health movement is focused on, and again, if anybody's from this movement, feel free to overspeak me. I'm not the expert. I'm coming from the outside, but saying that, we're looking at the health systems and the interactions between people as we become more international. You can hop on a flight and move from one half of the world to the other in less than a day at this point. What are the human-based systems that allow for disease spread, but also the structural and social support systems where we can bolster and help one another as well in terms of emerging diseases or aid? So that's my perspective. Planetary health is, yes, that's a part of it for sure. It's just saying that if you don't happen to be in that space, you can bring a different perspective that might influence that. Think about, for instance, in that space, the people who are experts in business and supply chains. That's a whole field that's cropped up since COVID-19. And I just mean to say in planetary health, because it is so macro, there are ways that you can find yourself into that system where you're like, oh, I can see how either what I'm doing with it is developing and engineering better systems to make supply chains move better versus AI algorithms that look at where we're sourcing materials, or the life cycle analysis of what's going on with them. All of these different people can find ways to connect through a planetary health framing. So again, it's not that it's superior in a sense that planetary health is better. It's not. We're all working on these issues together. The way that I look at it, and the way Sam Myers, one of the founding members of the planetary health field, says it, he's an internist using the language of a doctor. is that if we get the diagnosis wrong, we get the treatment wrong. And so if we're just focused on narrow slivers that are not talking to each other, we're not going to treat the problem effectively. Again, think about that critical patient that I was just discussing. All right, we're going to scroll down here too. All right, so I think, let me look back up one more time. I know we're getting close on time. Somebody made a comment on living wage for workers earlier. I think that's one of the only other comments I hadn't highlighted and lifted up. Sorry if I've missed anybody else's, but yeah, you heard that message in there about paying nurses more. And again, I love our administration at Hopkins. I love our nurses too. And I just say, when I meet people and see the jobs they do, I just am putting out a plug there for the value of work. You know, physicians and nurses and people in my world are already on a pedestal in some regards in society. We were the healthcare heroes during COVID-19. But, you know, when your toilet exploded during COVID, you needed a plumber. That's a hero. The way that I look at this is I kind of think that a lot of, when we say frontline workers, healthcare falls into that: fire, EMS, police, you know, different civil service organizations that stand up to meet the moment. My take on this is everybody who's a worker, the skilled trades and craftspeople and artisans and all these people where our society, you know, Planetary Health looks at this as sustainable is important, but we are not yet sustainable. We are still running into the red. We need to build the future aggressively in ways that will be sustainable. And in order to do that, we need the plumbers and the electricians and the construction workers and the architects and all these different people that build these spaces. And that falls into what we're working on in the Alliance, but also the Institute. But it's putting value on the work that is being done to do that. And that's a doctor telling you that I respect my municipal worker because I value that if they don't do their job, people get sick. They are my peers and they are my colleagues. Let's see, I think we got a couple more questions. How are you educating people to shift their perspectives from human-centric to planetary-centric? It's a really good question, because again, if I have that single mother who's working 2 jobs, who's in the emergency department because she's in diabetic ketoacidosis, because she can't afford her insulin, and she's got to get home to her kids and get back to work. Do you think if I start railing on about climate change, that's going to make one bit of difference? No. But if I start talking about the fact that I value the work that she's doing and that that work is actually related to what I'm working on in Planetary Health, and that's so cool, and engaging her in the fact that she's supporting her kids by doing that job, and how I see a connection to a solution that she's implementing, to me, that's giving people a sense of purpose. The same way I found in Planetary Health, you're just finding a connection. You're finding, you know, you're checking your pulse and realizing again that you have that legacy to give. And it doesn't have to be that you're a physician at Hopkins. It's that you are where you are in this world. You are alive and part of the Anthropocene, and you can be part of the problem or solution, but it's not as hard to be part of the solution as you may think when you get all doom and gloom. There's a lot of hope. You know, the best messaging I have to offer is that hope and love, as corny as that sounds, those are the things that are going to get us through this. And I still see a lot of that every day with every patient I take care of. So I think we're going to wrap up there. I just really want to say thank you to the Hopkins at Home team for allowing us to do this. This has been a great session. Thank you for logging in so much. Thank you for tolerating my unshavenness and my scrubs with our current family medical drama, but also thank you for whatever you do or have done in your legacy for the planet, because my mother-in-law is alive and doing better. And I attribute that to the work of something you may have done, or you're doing something else to make somebody else's day more meaningful and productive and free. And just want to make sure you recognize that you have a big part to play in what we're trying to do. Please reach out to us if you have any questions. At the Institute, there is a Connect to Us page, which goes through our administrative staff. I'd be happy to try to facilitate any ways of engaging you further on this topic. So again, don't forget, there's a great library of other videos that even I was starting to watch, getting distracted trying to put this video together myself. It's a rabbit hole of very good content. So again, my appreciation to the Hopkins at Home team. Thank you very much for what we do. I hope you have a good afternoon.